Project 2025. What it means for Louisiana. What if the fundamental systems designed to protect everyday Americans were dismantled? What if decisions affecting your taxes, your healthcare, even your children's education were shifted further into the hands of politicians and corporations? That's the potential impact of Project 2025, a plan gaining traction that proposes a radical overhaul of our government. While it claims to offer solutions, a closer look reveals specific ways this agenda could negatively impact the people of Louisiana. Today, we're breaking down the numbers and exploring exactly how Project 2025 could affect your life right here in the Pelican State. Let's start with your wallet. Project 2025 outlines tax changes that would disproportionately benefit the wealthiest Americans. While the plan promises big cuts for those at the very top, the burden would likely shift to the middle class. In fact, under this plan, the typical family of four right here in Louisiana could see a tax increase of around $2,398 every single year. Meanwhile, nationally, about 45,000 households with incomes over $10 million could each receive an average annual tax cut of at least $1.5 million. It's a shift that could squeeze the budgets of working families in Louisiana. Next, let's talk about your future and the security of Social Security. Project 2025 proponents have expressed support for raising the Social Security retirement age. This seemingly small change could have a significant impact on a vast majority of Louisianans. Approximately 74% of Louisiana residents affected, 3,385,891 people, roughly 74% of Louisiana residents, that's about 3,385,891 people, could see their retirement age pushed back. Ideas aligned with Project 2025, like increasing the retirement age from 67 to 69, are reflected in recent Republican Study Committee budget proposals. Benefit cuts: $4,100, $8,900 per year. Median wage retiree lost 10 years. $46,000, $100,000. Delaying retirement could lead to benefit cuts of between $4,100 and $8,900 in just the first year, depending on when you decide to claim. Over 10 years, a median wage retiree in Louisiana could lose anywhere from $46,000 to $100,000 in crucial retirement income. Healthcare is another area facing potential significant changes under Project 2025. The plan includes proposals that could directly impact access to and the cost of healthcare for many in Louisiana. Medicaid enrollees at risk: 109,600 people. One key proposal involves imposing limits or lifetime caps on Medicaid benefits. In Louisiana, this could put approximately 109,600 Medicaid enrollees at risk of losing their coverage. These are often low-income individuals and families who rely on this program for essential health care and may lack other affordable options. Increased prescription drug costs: up to 327,110 people. Furthermore, Project 2025 aims to eliminate out-of-pocket Medicare drug cost limits and prevent the government from negotiating lower drug prices. This could lead to higher prescription drug costs for up to 327,110 people in Louisiana, making vital medications less affordable. The plan also addresses issues related to abortion rights and contraception. Proposals within Project 2025 could significantly alter access to reproductive health care in Louisiana and across the nation. Women losing free emergency contraception access: 555,000. The plan seeks to remove some emergency contraception medications from the list of free preventive care requirements. This could mean that around 555,000 women in Louisiana would lose guaranteed access to free emergency contraception. Additionally, Project 2025 suggests misapplying the Comstock Act, a set of old laws, to effectively ban the mailing of medication abortion nationwide, even in states where abortion remains legal. It also encourages legal action against local officials who don't enforce state abortion bans, like the current one in Louisiana. The well-being of Louisiana's children is also addressed in the proposals. Project 2025 includes plans that could affect early childhood education and support for low-income families. Head Start elimination, affecting 18,537 low-income children. The plan calls for the elimination of Head Start, a crucial program providing no-cost child care and other essential services. In Louisiana, this would impact 18,537 low-income children, potentially removing a vital lifeline for families in rural and underserved communities already facing childcare shortages. For those pursuing higher education, Project 2025 proposes changes to student loan repayment. The plan suggests replacing current income-driven repayment IDR plans with a one-size-fits-all program. Borrowers facing increased payments, $101,900 in Louisiana, payment increase to $1,700, $4,100 per year. This could mean increased payments for all borrowers currently enrolled in IDR plans, including the SAVE plan. Finally, let's look at the potential impact on public education in Louisiana. Project 2025 proposes a significant shift in the federal role in education. Elimination of the Department of Education, loss of teaching positions, 5,076 in Louisiana, students affected, 88,834. The plan advocates for eliminating the U.S. Department of Education, including Title I funding. Title I is designed to provide additional resources to schools serving low-income students. Ending this funding in Louisiana could lead to the loss of around 5,076 teaching positions, directly impacting the education of approximately 88,834 students across the state. Project 2025 is a comprehensive plan with far-reaching implications. Understanding the specific ways it could affect Louisiana, the numbers involved, and the potential consequences is crucial for every resident. Do your research, explore Project 2025 and understand the full scope of its proposals. Discuss this with your community, talk to your friends, family, and neighbors about what this could mean for Louisiana. Contact your representatives, let your elected officials know your concerns.